Now, a GMA medical alert. By now, everybody's probably heard of MRIs, magnetic resonance imaging. It's one of the safest types of scans you can get, but a growing number of doctors are now reporting an increase in problems reading MRI results. ABC's Lisa Fletcher takes a look.
The pain in Katie Vincent's leg was so severe, she begged doctors to give her an MRI.
It was just constant. It didn't matter if I was sitting, laying, not even on my leg at all. It was just a constant throbbing, achy, horrible pain.
When they finally did the scan, the results were stunning.
I just couldn't believe they were saying that it was normal because I know her. She's really strong and she couldn't function.
Katie's doctor had given the 24-year-old the all clear. That couldn't have been further from the truth.
She would have died. If she had just stopped with a, quote, normal reading and nothing further had happened on this, she would have died.
Dr. William Bradley is one of the country's top radiologists.
I've seen subtle abnormalities missed, but I have never seen anything this obvious missed.
Katie was a victim of a misread MRI. Her persistence led her to a second opinion, revealing cancer.
He threw out a bunch of words like lymphoma, benign tumor.
It must have been terrifying.
Yeah, and to know that they missed it, it was horrible feeling.
She had non-Hodgkin's lymphoma.
That's the site of the tumor.
She spent the summer in and out of the hospital having chemo and radiation.
The doctor misread the MRI. Your pain could have subsided, and then what would have happened?
It could have gone months or years, and it could have gone to stage 4 and been horrible. So
it could have killed you.
Yeah, exactly.
Doctors at academic hospitals around the country report that misread MRIs are tragically all too common.
It's very common that we're asked to look at another set of images. Frequently, our surgeons and our other physicians will bring us images from their patients to reinterpret.
One problem doctors mention: radiology groups, where physicians are more generalists than specialists.
One day they're doing MRI, one day they're doing mammography, one day they're doing angiography, ultrasound, CT. They do everything. But it's the old jack of all trades, master of none.
It's not only the skill of the radiologist that guarantees a correct diagnosis, it's also the quality of the image. The stronger the magnet, the better the picture.
The 3T or 3 Tesla machines are the gold standard in terms of picture quality. Tesla is the measure for field strength. The lower the magnetic field strength, the less clear the image.
Here we go.
The American College of Radiology accredits MRI facilities around the country to be sure that they are up to current standards. But the accreditation isn't mandatory. For Katie, an all clear on cancer and her recent engagement have her feeling renewed, but her experience is still raw.
You have to question everything. You can't let yourself slip through the cracks.
For Good Morning America, Lisa Fletcher, ABC News, Longview, Washington.
And joining us now to talk more about this, ABC News medical contributor, Dr. Marie Savard. Thank goodness that Katie had the gumption to ask for a second opinion on this.
Right, to trust her own instincts. She knew something was wrong.
So how often is this happening?
I think it happens more than you might realize. And the truth is, there's a number of steps that patients can take to make sure that they get the best possible scan.
All right, so let's talk about this. First thing you say is just know your own history, kind of walk in with information.
Right, the more extensive your history, the best type of test is going to be ordered, because maybe it's an MRI, maybe the radiologist wants to order a special dye with it. There, really depends on your clinical history. So,
and it sounds simple, but just kind of know what you're walking into, know what your own history is. Have a specialist read the MRI?
Absolutely. As you heard, it's really important. You don't want a generalist physician, someone who is looking at mammograms and chest x-rays. You want someone who is spending their day looking at MRI results. They're trained in that. It's a very special area. That's critical, but not just who's reading it. The next point is make sure that you ask for a closed rather than an open MRI.
Well, let's talk about that, because this was like the wave of the future, right? That they were going to have these open MRIs where you don't have to be. I've had one, and you're inside this closed space. It's really uncomfortable. It's scary. If you're claustrophobic, it can be really bad. You're saying don't do the closed one if you can.
Closed ones in general have much higher intensity magnetic fields, so they really give you what's like a high definition picture, as opposed to an open MRI for people that are claustrophobic, extremely overweight. There are times when that's important, but the intensity of the magnetic field is much less. The images are much less. It's like a black and white fuzzy television
So
set.
the equipment's better on the closed. If you can take it,
Right. So
bear
you want
with
the best doctor. You want to make sure it's closed if possible, and get test results.
And what about the test results? How do you make sure that your doctor is reading them correctly, that you're getting the results?
Well, the bottom line is no news is no news. So if you don't hear back, you need to make that phone call and ask. Even if you go to give your doctor a self-addressed stamped envelope or have them email you test results, you want a copy. First of all, by having it in your hand, you can review it, make sure the history is correct. Make sure that another doctor that you're going to see.
And they'll give that to you?
Yes.
Not a problem?
You are entitled to that information. You need to get a copy. There could be a mistake. You could have fallen through the cracks for another reason.
And the bottom line, like you said, like Katie, if you feel something's not right,
trust your own health radar, because you know what's going on. If the x-ray doesn't match what your body's telling you, if you've got a red alert, something is serious going on, persist, see another expert. Whether the scan is positive or negative, you need to follow through. It's only a test.
Okay, Dr. Marie Savard, thanks so much. And for more information, you can log on to abcnews.com.